Hello, welcome once again to Moorgate Andrology, and today I want to talk about a subject which I get asked about all the time from most patients who have had penis enlargement surgery, and that is a tight foreskin after penis enlargement surgery. So, if you've had girth enhancement, that is to say a fat transfer after having penis enlargement surgery, then your urologist will have warned you that it's normal and very common for your foreskin to become really tight after the surgery. And this is completely normal after a big fat transfer to increase your girth. And you'll notice this tightening pretty soon after the surgery, and it will be difficult for you to retract your foreskin. Now, what you should do in the days that follow anyway, the urologist will tell you to massage the penis. This is just to keep everything nice and symmetrical up and down the shaft as some of the fat disappears. As you know, around 30% of the fat that is transferred in penis enlargement surgery does disappear. And we know this, and we allow for this in the amount of fat that's transferred in the first place because we know this is going to happen. Anyway, as the fat breaks down, you're told to massage. And this massage will help to soften the fat, and also it will help to get rid of this tightening of the foreskin. If you find that the tightening is particularly bad, then you should massage from the tip to the base, moving the fat backwards, not from the base to the tip. So from the tip to the base, that's very important to remember. And you'll find that after a few weeks, normally 6 to 8 weeks later, this problem should have settled down. And the problem occurs because the fat naturally migrates a little towards the tip, and the foreskin is very soft, so it's easy for the fat to find its way there and cause this tightening of the foreskin. Now, what should you do if you already have a tight foreskin? So we get lots of patients coming to us at Moorgate Andrology, and they already have a tight foreskin. And this is a condition called phimosis, and it's where you cannot, or you find it very difficult to retract the foreskin fully. Now, if you have this problem, then this is only going to get worse when you've had a penis enlargement surgery. So don't be surprised if the urologist recommends that you have a circumcision at the same time as your penis enlargement. And this might be a good option to consider, because obviously if the urologist removes the foreskin at the same time as doing your fat transfer, then you can't have the problem of this tightening of the foreskin. Also, there's a little bit of an advantage in we can get the fat a little bit lower down the shaft if you are circumcised. Having a circumcision together with penis enlargement surgery is not uncommon. We get a lot of cases where guys choose to have a circumcision at the same time as having a penis enlargement. Not always because they have a tight foreskin. Sometimes they just prefer that their penis was circumcised due to health reasons or just purely aesthetic. They feel their penis looks better circumcised than not. But if you have a tight foreskin to begin with, and you're thinking about penis enlargement surgery, then circumcision is certainly something you should at least discuss with the urologist. Now, after circumcision, everything should settle down. The fat should settle again. All this takes about 6 weeks. So when you've had surgery, make sure that you allow a little bit of time off. Usually about 2 to 3 days in a sedentary job, maybe up to a week if you have a job that's a bit more physically demanding. So that's all from me today. I hope you've enjoyed this video on tight foreskin after penis enlargement surgery. It's one I've been meaning to do for quite some time because we get asked about this all the time. Until next time, I'll see you back here at Moorgate Andrology soon. Thanks a lot for watching, and bye for now.